When people think about CPR, they tend to be thinking about older folks. And in fact, the truth of the matter is, in the city of Spokane anyway, most people who have cardiopulmonary arrest fall, or the largest age group category is the age between 50 and 60 years of age. But it also occurs in children, and it's very important for every parent, every aunt, every uncle, every grandparent, every brother and sister to know how to do cardiopulmonary resuscitation on a child. Children do have cardiopulmonary arrests. In general, their cardiopulmonary arrests are preceded by some sort of airway problem or a respiratory problem that leads to hypoxia, hypercarbia, all of those biochemical changes that cause them to go into cardiac arrest. And for that reason, we have a little bit of a different approach to children than we do to adults. For the purposes of determining when to start cardiopulmonary resuscitation, in other words, how to define cardiopulmonary arrest, we define it by two things. Number one, the patient is not responsive to the usual stimuli. In other words, you shout, you shake, you tap them on the shoulder, they don't respond. And number two, they're breathing abnormally. Not necessarily not breathing, but breathing abnormally. They could be breathing very slowly, they could be snoring, but if they're non-responsive and they're not breathing normally, that is by definition, or at least by functional definition, that is cardiopulmonary arrest, and those patients need immediate cardiopulmonary resuscitation. Now, because of this difference that I just pointed out between adults and children etiologies of cardiopulmonary arrest, it's important to remember that kids need air. Adults, hands-only CPR is now what we recommend, but in children it's different. In children, because of the fact that it's frequently preceded by respiratory failure or an airway obstruction, we strongly recommend that the patient be given air. So if you determine that the child is in cardiopulmonary arrest, you start chest compressions at a rate of 100 per minute, just like with adults. And the only difference really is that after every 30 compressions, you stop and give 2 breaths. You should not spend a lot of time giving those breaths because it's very important for you to not stop the forward flow that you've established by doing chest compressions. Every time you stop chest compressions, you lose a little bit of the ground that you've gained, and you have to regain that back. So you're giving up ground every time you stop to do the respirations. But given the probable etiology of the arrest in a child, it's important to give them air. So if there's just one person doing the resuscitation, then you have to stop the chest compressions after 30 compressions, do 2 quick breaths, taking about a second per breath, and then right back on the chest, 30 compressions, 2 breaths, 30 compressions, 2 breaths, until the advanced providers arrive, the EMTs, paramedics, and the patient could be transported to a hospital. There are some differences in the way we approach the very young child as opposed to the relatively older child. So for those purposes, we sort of divide them into 2 groups. The group that's 0 to 1 year of age, infants, and the people that are children, ages 1 to 8. When they're over 8 years of age, generally we treat them the same way we would an adult. So the children who are between 1 year and 8 year of age, we do the chest compressions the same way we would with an adult. We use the butt of our hand, put it on the sternum, compress a third of the sternal depth, which is usually going to be about 2 inches in a kid, just like it would be in an adult. In the infant, then it's 2/3 of the chest dimension is going to be more like 1 inch or 1.5 inches is usually what's recommended. So about 1.5 inches, a little bit less depth than with the older child. The other difference is that in the infant, you want to use your fingertips. You want to put them right in the middle of the sternum, just below the nipples, and do your compressions with your fingertips because they have a much more compliant chest wall than the older children. It's always important to bear in mind that these children who have cardiopulmonary arrest might very well be choking. So if there's any indication that this is a choking episode, one would want to, of course, apply the appropriate measures for relieving that problem. And if that is noticed before the child actually goes into cardiopulmonary arrest, then there are some things that can be done. If the child is in the age group of 1 to 8, the preferred methodology is an abdominal thrust, or what we refer to as a Heimlich maneuver, where you put your fist on the child's belly and compress forcefully, quickly, and try to force up air up out of the airway and eject the foreign body. You can do that repeatedly. If the child happens to be obese, which is increasingly a phenomenon, at least in this country, you might want to use a chest compression. That's going to be more effective. So you do the same thing by putting your hand on the child's chest and compressing. In the age group that's under 1 year of age, 0 to 1 year of age, the preferred methodology, the recommended methodology, is that you do a back blow where you turn the child face down, back up across your lap. You deliver 5 back blows. If that doesn't work, you flip them over and you deliver 5 chest blows. If that doesn't work, you flip them back over and do 5 back blows, and keep doing that until either the foreign body is dislodged or help arrives. Or if the child goes into cardiopulmonary arrest, becomes limp and non-responsive, and is breathing abnormally, you would put them on the floor and start cardiopulmonary resuscitation. Usually these situations are pretty emotion-laden, and particularly when it's a child, it's difficult for people to remain clear-headed and objective. And for that reason, we recommend, the Spokane Fire Department and all the EMS agencies in the county recommend that recommend people to take some sort of course on this where they can actually practice on a mannequin, so that they can be a little bit more objective when these situations occur.